And hello, this is Dr. Latasha McElwain coming to you with a presentation overview of understanding trauma. This is for the purpose of giving good education basis of what goes on with trauma and how to understand a little bit more about trauma. This is for individuals in the clinical field working with mental illnesses um, and for the most part, want to start with the introduction of trauma, understanding that trauma is a response to a very intensely stressed event or situation that's happening in someone's life. And the individual that it's happening to, they're affected in a way that it could be long lasting. There are ways of considering healing. Um, from the trauma. However, a lot of times when we're talking about trauma, it is the response to those very stressful situations. So when we think about traumatic events, it can happen at any age. For the most part, it also, in the research that I've been looking into, a lot of times, they're saying that trauma can happen in as early a stages as in the womb. So with thinking about that, you have lasting effects that could be physical effects, that could be mental well-being, affect your mental well-being, ongoing mental illnesses can come out of the type of trauma that individuals can experience. So each person's trauma is different. It's very unique. It's very, you know, common to say that there are different things that cause it, but there's so many different things nowadays that cause trauma that we are seeing that a lot of things that go on in individuals' everyday life might be quote unquote normal for one person, could be totally unusual for another person. And sometimes those things can cause issues with post-traumatic stress disorder. It can cause issue with having a long history of anxiety, built up, pent up energy for the most part. People end up having flashbacks sometimes, and people definitely deal with sleep disturbances. They kind of aren't able to get their sleep, or their sleep is distorted in some type of way. So a lot of times when we're thinking about trauma, trauma comes along in a lot of our lives. I tell people a lot of times, even being in a vehicle and hearing the screech of a car accident and actually seeing that car accident could be a traumatic event for someone, especially a new driver or an older driver or a younger driver that's just not expecting this beautiful sunny day to turn into a day where we're going to experience a car accident. So when we're thinking about trauma, trauma does not discriminate. Doesn't matter who you are, what's going on in your life, what your race is, what your ethnicity is, what your age is, what your sexual orientation is, what your gender identity is, what your background is. Trauma can affect everyone in their everyday life, depending on what's going on and what they are exposed to. So when we start talking about what is trauma overall, we look at trauma as referring to that response following an event. Most of the time, the event has it overwhelms us psychologically. It also definitely puts us in a point of shock. We're kind of shocked that it happened. We're kind of in denial that it's happened, or it changes our body and our mind and our behavior. So it gives a feeling to us a lot of times. It gives reactions that we kind of respond to, and kind of in some situations we see where individuals may act a certain way or act out in a certain way, or their brain might start thinking in a different way, or might have behaviors that they might be anticipating something. So trauma, comes along when you start talking about some of the research did get information from the Substance Abuse, Mental Health Services Administration, SAMHSA. And it basically says that trauma is an event you experience as harmful or life threatening. So it could be something that's very, near and dear, and you feel that something's going to happen to you, and then it has a lasting adverse effect, which means that your mental health is challenged, your physical health might be challenged, your emotions might be challenged, your ability to socialize, the social piece of it, that could be challenged. Spiritual well-being can also be challenged as well. So usually when we talk about trauma typically associated with significant events such as physical or sexual assaults, violence, again, accidents. We're also learning that trauma, when we're talking about post-traumatic stress, we're talking about, you know, individuals in the military that experience war or have experienced some strenuous, stressful activities. Being in the military alone, sometimes we've seen where a lot of individuals have dealt with a lot of trauma, and like I said, it comes along with that post-traumatic stress disorder. But those things do occur and cause those concerns. So when we look at complex trauma is when things are repeatedly occurring and happening over and over again. It could be, it could have the impact on the individual is like a cumulative impact, pretty much. So it's like these things are happening and they're happening again and again and again. Or these one of the things I like to kind of say it is, it's like if you're growing up in a traumatic type situation, or a situation where there's a lot of moving back and forth and trauma and drama and everything else to go along with it, moving from foster home to foster home or from service to service or whatever the case may be, some of our children, they can definitely say that they're dealing with complex trauma based on all of this movement around, when a lot of times we do look at adolescence and in childhood, we look at individuals, we look at the lifestyle of a child to be more stable and more consistent. And because of some of the things that some of our younger individuals deal with in childhood, this is a lot of childhood trauma that comes along with moving around, different things going on. But a lot of times we do try to make sure that we understand that early experiences of trauma can leave a deep imprint on a person's worldview, their sense of self, and their relationships later in life. So it does impact them in a way that we should, as professionals, we should know about and understand what trauma is, and understand that, again, it could be different for everyone. It could be someone in a very stable home and not dealing with that level of trauma, like moving from place to place, but just dealing with that level of trauma of not being or not feeling like their parents have time for them, or their parents love them, because their parents work so hard and go out every day and they feel like they're like invisible. So that could be a level of trauma also. And that could be a complex type trauma, because individuals will feel like they deal with that behavior at home from their parents, and then they deal with whatever they deal with at school, and then all of a sudden you see a total different person acting out. So the child acts out on the fact that they feel invisible, or they don't feel important, or they don't feel they don't have that level of love for themselves and things of that nature. So again, thinking about childhood trauma, we see so much and so many differences when it comes down to children, that we have to be mindful of what trauma is, and talking about complex trauma as well. Moving right along, talking about the acute trauma. So the acute trauma, a lot of times, that's kind of like the immediate after ongoing thought, pretty much a single traumatic episode, you kind of have that immediate response. So a car accident would be one. And I mentioned car accidents earlier, but a car accident could be one. That could be an acute trauma. Basically, the symptoms last for about 3 days. It could be a little bit longer, it could be up to a month, but a lot of times it triggers, there are other triggers that also hit those acute trauma type situations. And I'm thinking of one totally in my head here. I remember being in a car accident in a work car, which would be my state car when I was a probation officer. And as soon as I heard the wheels screeching, I was in my seat saying, "Oh, please don't hit me, please don't hit me, please don't hit me." And boom, they hit me in the back. So it was like a chain effect. It was a couple of cars. So now, as still an adult, I hear a screeching. It scares me to a point where I'm like, please don't let that happen again, but it has happened to me. And so it could be considered a, acute trauma type scenario where as soon as I hear that screeching, as soon as I hear cars kind of, and it was a bang, bang, bang buildup in that accident where several cars hit each other. And then I was kind of like I think the last one they hit, and then I got pushed along a little bit as well. But luckily, I didn't hit the person in front of me, which was amazing and good for me because then I wouldn't have had to say I hit someone in my state vehicle. But I digress from here to there. So wanted to just say that a lot of times when you think about terrorism, you think about childbirth, you think about natural disaster, you think about transportation accidents, you think about serious medical events, think about physical violence, you think about sexual assaults, warfare. All those can be a level of acute trauma that people can actually experience and deal with. From time to time, like I said, 3 days to 1 month is usually about the time frame. And then other triggering events can also, add to it from time to time, depending on, kind of what's going on, what scenario you're in situations. When we start thinking about chronic trauma is also a prolonged exposure to the distressing events. So a lot of times abuse, bullying, domestic violence, all of those kind of are the ones that we talk about that have great impact on individuals. And they also definitely have us to look at, okay, we do want these things to, stop, but it's things that, continue on, and it's progressive and it's over time. If we talk to a child about bullying, a lot of times they'll tell us that the bullying was going on from this grade to that grade to that grade, from elementary, middle to high school. They feel that way. And then sometimes we do run into individuals that, become a little bit older and realize that they're being bullied in the workforce and things like that. So we have to be mindful of things like that, especially domestic relationships. We have to be mindful of that too. And the exposure to domestic relationships. Sometimes we watch, children, because we do work with children a lot. Working with children, we realize that they've been exposed to domestic violence. Not only have they been exposed to it, they've been in a real, a rough family dynamic where they're feeling like they watch mom bully dad or dad bully mom, or, family dynamics that get a little, out there. So when we're talking about chronic trauma, we're looking at, so here, just going back to some of the research, trusted sources basically talked about some that you can experience racial trauma from being repeatedly subject to racism or racial biases. So that can happen, of course, in the workplace, that can happen at school, that can happen in the community, in your neighborhood, different things like that. And then witnessing media type situations where there's violence going on. And sometimes we notice that, in our communities and groups that we belong to, that things go on that's just, not, pleasant. That's one of the reasons why, we do try to equip our young people that we're working with in many situations in our life. We try to equip them that if you feel uncomfortable, whether it's someone speaking to you or someone doing something to someone else, we try to help them understand that you can get help for that. You can talk to someone else about it, or you stand up, or whatever the case may be. If you feel like something's wrong and, someone's being bullied and you can help or you can step in, we try to, encourage our younger generation about, different things that could cause a level of, again, chronic trauma in their life. With COVID-19 pandemic, there was a lot of things that went on, of course, around the world, but the effects from a lot of what went on was, it was unprecedented trauma. It was trauma on a global scale that it was, whether you're an adult, whether you're a child, whether you're a new baby that was coming into the world. We call them little COVID babies now. There was a lot going on. And I'm sure that as we get farther into the fact that COVID has happened and we are now we were first pre-COVID, now we're post-COVID, we will, realize and go back and realize that this was a level of chronic trauma. I mean, I'll tell anyone I was traumatized by just watching the TV the whole time that I was out of work because I couldn't go back to my workplace during COVID. And that, just watching what was going on TV, along with just trying to take care of myself every day and realizing that I was at high risk as well of catching COVID. I was pretty traumatized by watching some of the things on TV to the point where I stopped watching TV. I started watching TV because I didn't know what was going on. I'll say it like this. I started watching TV because I wasn't watching TV. And then I started watching TV because someone came into work and said something like social distancing. That's the new word. And I was like, what new word? And I had no idea. And they're like, you're not watching the news? And I was like, no, I don't watch TV like that. And then I ended up watching the news, and then I saw what was going on. And then I was sent home. So I had no choice but to kind of figure out what I was going to do with my entire day if I wasn't sitting in front of my computer screen. So some of the time I was watching TV to the point where I just got fed up and I stopped because I was like, this will be something that's going to go down in history. Of course, it's unprecedented. We've never had any situation like this before. But the biggest part of it is that we really had to watch ourselves consuming a lot of what was going on during COVID. So I'm going to close on that and move on. Talk about vicarious trauma. So in the counseling field with us, we have to be mindful of vicarious trauma all the time because technically, when we are seeing a lot of our clients and working with a lot of our patients, we are taking on the trauma experience that they have had because we're listening to it and we're helping them kind of unpack all of that. And we're helping them realize, these are just my words, we help them unpack what's going on or what went on with them. We start to help them to compartmentalize everything and figure out, where things need to be. And then we start to help them kind of repack. And repacking means that you repack these things back in areas where you are able to handle it, understand it. I would say be in control of it versus there might be things that trigger it, but you are able to cope and deal with that if that trigger comes up where you won't have a total meltdown or a whole different traumatic experience again. So talking about how we as therapists or counselors working with our patients, that's where we're talking about the vicarious trauma. That's where that comes in. So a lot of times, again, first responders, if you think about being in one of those first responding positions like a police officer, EMS, fire, they call it, say, fire and medic. Those individuals on the front line in the hospitals, in the emergency room, I can say that I'm probably one of those persons as well on the front line in the emergency room, the behavioral health emergencies that people are having. I am that person that they talk to first when it comes to behavior health. So I do tell people, you have to be mindful of vicarious trauma and what's going on with families and what's going on with individuals and why they end up in front of you, and you have to hear that story. But a lot of times that's something that, we try to work on and take care of ourselves and listen to our bodies, listen to our minds, listen to the fact that we need to take care of ourselves and we need to, de-stress, and we need to, walk away from things. When I get to a point where I can't handle but so much that's coming at me, I go ahead and talk to my coworkers and then have someone else step in to take care of that so I can go and de-stress for a few minutes, or I can move on to the next patient that I, have to work with, or whatever the case may be. So vicarious trauma, that's another one. We have to be mindful of vicarious trauma. When we're looking at what are the mental and physical effects of trauma. So physically and mentally, trauma can definitely hit in different areas in your life. A lot of times I tell people it's not just your emotions. No, I feel a certain way. No, it's a lot. It could be, social impacts. It could be physical well-being impact. It could impact a lot of areas. So due to the extreme stress on the body and the mind, a lot of times we can become very overwhelmed, and we can we can be engaging the nervous system, fight, flight, or freeze response. So when we're thinking in terms of that, we need to be able to, look at things and, like I said, really understand more about trauma as we're working with individuals that pretty much are coming to us because they're stressful situations, they're traumatic situations. A lot of times we look at some of the symptoms when we're talking about symptoms of post traumatic stress. A lot of times it's the after effect of the overwhelming of the nervous system. So that's why a lot of times with us being professionals, clinicians, counselors, um, we have to make sure that we are definitely, oh, social workers as well. We have to make sure that we are um, able to take care of ourselves in a way so that we can really, really watch the overload on our nervous system. The body and the mind can't fully process the traumatic event, and then what happens is we end up in a position where we've taken on all of that, and it does cause us concerns. It causes us concerns later on in life, or as the months to days go by, for the most part. So the effects of trauma can affect you in many different ways, and I've seen where some of the stress and some of the backlash from the trauma physically, some people have really gotten in a real not so healthy situation, medically. So I always tell people, it's not just, one area, it's kind of, being mindful altogether. So when we start talking about some of the common symptoms after trauma, including a lot of times people end up having very intrusive thoughts. People also have issues with flashbacks and nightmares. Sometimes they do avoid things that remind them of the trauma, including people, places, and objects. A lot of them become very hyper vigilant and being more aware of danger. Being easily startled or kind of jumpy for the most part. I tell people the other couple of weeks ago experienced a snake and it kind of took me by surprise seeing a snake. And yeah, I was startled, and then so the rest of the night I was pretty jumpy. So depending on the level of dealing with things, and I wouldn't say that was full trauma, but it was kind of traumatic to walk out, to my front yard and see a snake laying across the driveway. So that was kind of traumatic for me. But again, like I said, trauma is different for everyone. So again, when we're talking about being activated by triggers that remind you of the trauma, a lot of times, whether we're conscientious of it or it just happens sometimes. Changes in how we see how you see yourself. So how we see ourselves, that kind of cause some concerns for us, such as whether we believe that we're bad or we feel like we're guilty, excessive guilt and shame. And then also some of the common symptoms after trauma also include a small window of tolerance, meaning that you feel you feel overwhelmed easily and have difficulty controlling your emotions. So a lot of times that do come up as well. So we have to be mindful of that when we see it. And then when we start talking about traumatic stress, pretty much it can show up in your physical health too. And I was mentioning that a little bit earlier, mental and physical. But the mental side of things is some people end up having some chronic pains. They have some body concerns that just, really they have issues with their sleeping habits. They have issues with chest pains. I always tell people a lot of times when people come into the emergency room, we talk to them about having chest pains, headaches, or just that if any of them, might be dealing with some chronic issues, especially chronic chest pain. That's a big part of anxiety in itself. So when we're talking about trauma, we are looking at the fact that, chest pain comes out of that. Headaches, people have headaches, just throbbing headaches, it's just that they're dealing with so much, their body is kind of under attack. And again, we said chronic pain again. So again, like I said, those are some of the things that we can think of because it does affect our physical health, and we need to be mindful of that. So moving right along, causes and types of trauma. So a lot of times we do look at trauma with children because that is kind of the main thing that happens a lot of times in situations. So basically, we're talking about events that lead up to trauma. Sometimes there's medical trauma. I did mention earlier that, we say trauma can happen even from the womb. So a baby and, when a child is being delivered, that can cause some trauma on the child as far as, not be able to get enough, not being able to breathe, or, something's happening with the baby, might be breech or anything that's happening like that. So it could be some medical trauma that's happening. A child could definitely be born and then all of a sudden stop breathing, and they have to give the child air, to breathe and things like that. Or child can come out a little jaundice for the most part. So a lot of things can happen. A child can come out just being born and probably have their lung haven't developed all the way, or their heart haven't developed all the way. Something hadn't developed. So there's a lot of medical trauma when we think about that can go on in a child's life. And then we're talking along the lines of sexual trauma, family trauma. Definitely, when we're looking at grief, we're looking at violence, terrorism. We're definitely looking at uh, watching or experiencing intimate partner violence, looking at domestic stuff for the most part, childhood neglect. Yeah, disaster traumas, like if there's a fire. Years ago we looked at Hurricane Katrina. That was definitely a disaster trauma where a lot of families were displaced, and we had a lot of children that were displaced here in North Carolina that came through that horrific storm. So um what else? So when we think about what mental health conditions are associated with trauma. So, a lot of times when we are talking about trauma, we're going to realize that a lot of our patients are going to be diagnosed with post traumatic stress disorder, PTSD. We realize that a lot of our patients might be, some of our patients might be diagnosed with dissociative disorder, uh, borderline personality disorder. One of the most commons that I see around the clock is depression and definitely anxiety. So those are the main ones that I see. Definitely working on the front lines in emergency rooms and in other areas of my career. I have seen a lot of that, dealing with depression, anxiety, and the trauma that people have experienced. All right. So, how to heal from trauma. So, a lot of times we definitely want to look at a lot of the therapies that come along with, knowing that you need to get some services in place, or it would be best and beneficial for a person to get services in place. So, cognitive behavior therapy is one that we kind of push really hard, kind of helping people realize that, changing their mindset and their thoughts, and, the outcome of what happens. And that's definitely there. And then we're looking at cognitive processing therapy. That's another one. Prolonged exposure therapy. So these are some areas that, of course, the American Psychological Association strongly recommend as far as therapy goes. We can also look at, when we say healing from therapy, I mean, from trauma, we can also look at EMDR. That's kind of one of those newer ones that came on the scene, not as of late, but late enough. In the 2000s, it became very popular. So that's the eye movement desensitization and reprocessing therapy, and then narrative exposure therapy. And then when we talk about making sure that you're looking for good supports, good mental health supports, Psych Central, how to find a mental health support resource may be helpful. And then we also look at the fact that you can also check into different types of traditional therapy like psychotherapy, expressive art therapy, creative writing, and theater. So those are all things that also can help with trauma. What I have learned from working with a couple of patients that definitely dealt with a lot of trauma growing up, the creative part of like theater and being able to act out things like that, a lot of them definitely made great actors and was very impromptu to do things. And it was things that made them a very, they were able to use that energy and use, kind of not necessarily what happened, but that, that same I guess that same side of the brain, and be able to produce such good work when it comes down to them acting, or them, showing their craft and how they, work on different things when it comes down to being in the theater or being, on TV or being in actress or actor mode. But a lot of times I do, because I have worked with individuals like this, we do focus on working on healing that trauma, but we bring in that creative piece as well. So that's something that I definitely want to say is helpful because I've experienced it and worked with individuals who have come to me and kind of gave me some ideas of what they're doing and how they're doing things in life. And I didn't want them to lose that creative part of what they were doing. So I kind of incorporated into the psychotherapy that I was doing with them and kind of kept things going. Expressive writing, keeping a journal kind of helps to improve the resilience to trauma. So that is, I can agree with that. That's something that's very, very insightful for a lot of my patients that definitely have gone through traumas in their life and want to really get to a better place in life. So this one right here is the Herman's model of trauma recovery. I just wanted to put this out there that there are some models out there. This model was one that I've never really used, but I really liked it when I was doing the research on this one. So this one really talked about based on this particular approach, you have steps that you have to go through for trauma recovery. So one is the first one is stabilization. That's basically setting up treatment goals to develop coping skills and establish more of safety within the self and with others in your life. So being able to realize that you can get to a place of stabilization. And then reprocessing, that's kind of remembering and mourning the trauma. Yes, I get that. In a safe place and being able to work through the grief. So that was also a big ding, ding, ding for me as well. And then reprogramming is then looking at integrating what has occurred and establishing a reconnect with the ordinary life. So basically being able to understand, focus in, get some stability, start to reprocessing through things, and then reprogramming. So that one really hit home with me. So the Herman's model of trauma recovery is a wonderful one. As I was reading through the research, I really liked it. So I definitely wanted to make sure I included it here. And then when we're talking about trauma-informed care, so when we talk about trauma-informed care, we have to think of the three elements that go along with trauma-informed care. So with this model, we're looking at realizing the prevalence of trauma. We're looking at recognizing how trauma affects all individuals, and then responding by putting the knowledge into practice. So what I typically tell people is in this whole model, I can see where when it takes into account that most individuals have experienced some form of trauma. We talked about that when we first started. So in one way or another, everyone has experienced some level of trauma. It might be different from one person, different to the next person, but everyone has dealt with some level of, oh my goodness, this is very traumatic for me. So we look at the next part here, recognizing how trauma affects individuals. It's kind of like knowing, basically noticing how trauma impacts each level of an organization or the system as a whole. So let's talk about families. Thinking about how the trauma has affected individuals in the family is a major thing that we always have to look at because, yeah, it does affect the family in certain ways. And we have to be mindful of how it's affecting our family, our whole system for the most part. Each individual has a different view or observation of the trauma. So then we look at it and then we see that the response, putting this knowledge that we've obtained in practice is being able to address it and being able to move forward. And a lot of times it did say that, excuse me, this refers to addressing organizational policies that may be re-traumatizing. So that's basically so that it doesn't happen again, or that we kind of break that spell or whatever the case may be. But a lot of times I do tell individuals, and I'm thinking more in the family situation, that we want to make sure as a family system as a whole, we want to make sure that we can handle situations and that we can, understand the prevalence. We can understand that all individuals are affected, may be affected in different ways, but are affected. And then we have to also look at the fact that we've learned something from all this. Let's put this knowledge into practice. So definitely like the idea of being trauma informed with our care, because that is something that is major, especially when events happen and occur. So, with all that being said, I have all the resources here that we went through and spoke of in this presentation. And so I hope that everyone feels very comfortable now with understanding trauma and getting a great idea for, okay, this is a level of trauma, or this individual, child that I'm working with, patient that I'm seeing has dealt with some trauma, and how I am in a position to assist in any way by having the knowledge I have and being, educated on more about trauma, so that I can be able to be of assistance to this individual when something happens or something triggers them or something is going on, and we need to move to the next clinical level in order to provide that assistance for that individual. Thanks so much for listening to this presentation. Again, this is a presentation on understanding trauma, and it is for supervision purposes.